interoperability of our health systems. The first achievement of our new interest group was a strong statement calling for solidarity, cohesion, and compassion at the European level. Looking forward, we see solutions, we see opportunities, we see a different future for Europe and an ambitious new health program. And this is what we would like to explore today. Before we look ahead, however, let's do a quick retrospective on where we have come from. The PACT was established in 2014, and since then we have been successful in bringing together for the very first time and on an equal footing public health, healthcare professionals and industry associations in a patient-led and focused partnership for a common goal, and establishing PACT as a kind of go-to organization on equitable access for the EU institutions. We were and we are a trailblazer in this in access. The European Parliament Interest Group during the last mandate played an instrumental role in ensuring that patient access to equitable, high-quality healthcare is high on the political agenda, working collaboratively with the other EU institutions. A recent achievement was the high-level conference in July 2019 under the Finnish presidency on the future of health in the EU, advancing the UN Sustainable Development Goals. And this resulted in the Health Pact consensus document, which was a culmination of much collaborative work, shared purpose and common vision for access. But ladies and gentlemen, we have much to build on. There remains much to do because of and yet beyond the pandemic. Our ambition over the next 5 years is to move to solution and learning mode. There has been a great deal of very good work on measuring the gaps and inequities in patient access across Europe. As patient leaders, we are well aware of the problems and the very personal and individual challenges a lack of access means in the daily lives of our communities. We need to take the bold step, and we need to look at evidence-based workable solutions that can be showcased, replicated and scaled throughout Europe on access. But PACT will not do that alone, but act as a catalyst to find the mechanisms and the partners to identify these solutions, assess them critically, and provide an environment where they can be promoted, understood, and the drivers for transformational change can be agreed in a truly multi-stakeholder, multidisciplinary way. The COVID-19 provides a wealth of learning in this regard, as we all know. Also, PACT can help to share some of the outcomes of the Beating Cancer program, which focus on equitable access, and PACT can explore with partners how these could be replicated in other disease areas, and similar outcome-oriented missions could be created. There are now several wider multi-stakeholder collaborations on health: the Health Coalition, All Policies for Healthy Europe, the EU for Health, among others. PACT has reached out to these to agree our role in helping to drive the access dimension of their work also. And this to create a culture of cooperation and maximum impact, and avoiding duplication and fragmentation. This is absolutely vital. We cannot afford to waste time, effort, resources, or political capital. Similarly, the interest group in the European Parliament will help to ensure maximum impact of the many events on access in this house, which is now virtual. In all of this work, we will be going back to our roots a little as PACT, and refocusing more our work in Central and Eastern Europe without, of course, excluding other regions. The interest group did a tremendous job in the last mandate, but I would like to see an even more assertive agenda this time around. I believe that the interest group has the capacity to be a real campaign engine and change agent for equitable access as a fundamental human right. We also need the full buy-in from the European Commission, and I'm delighted to see you here with us today. We will be coming to you for your thoughts on our current plans. We will also be accelerating our efforts with the EU presidencies to ensure that the access conundrum is a paramount theme, as we all have seen it is during this crisis. I would like to close now by thanking the co-chairs of the interest group enormously for their commitment to equitable access for Europe's patients, and to all of the PACT partners who will drive our work of the next 5 years. If we project ourselves to the end of this mandate, what will success look like? What will we be proud of? This, I believe, will be the red thread of today's meeting, and I hope that everyone will contribute and share in a friendly, frank, and open way. Thank you very much. Let me check now if our co-chairs are present in the meeting. Mr. Kovachev.
Yes. Hello from my side.
Excellent. Will you be able to put your camera on?
That's was my problem, because it's written video has been disabled for this meeting. I'm trying to do this, but I don't know why.
Okay, Eva, can you enable video? But in the meantime, you can start.
Now. Yes, now.
Excellent.
Now it's possible.
The floor is yours.
Thank you, Susanna, and thank you very much for the good cooperation with PACT in the last 5 years from the last mandate. I would like to also thank you to all stakeholders and my colleagues from the previous mandate, the co-chairs, my colleagues now from this mandate, the good cooperation with the DG Santé, and with the member states representatives in Brussels. As you remember, we started 5 years ago with this interest group of MEPs to give a platform to all stakeholders in the health area for exchanging their view, their thoughts about what could be the added value of the European Union to the efforts of the member states in the field of equal access to healthcare. In 2014, when we started, it was still the goal was to overcome the crisis from 2008, and the main slogan and topics was grow jobs. But there was many who forgot that growth and jobs are also related to healthy people, and that health is something what our European citizens are expecting to see engagement on the European level. Now, with the COVID-19 pandemic, this topic of health is right core of the agenda, not only on the national member states, but also on the European Union. And let me give you, but you know it very well, an example on the numbers. In the last multi-annual financial framework, we had around 400 million euro, only 400 million euro for the whole 7 years under the health program with Commissioner Andriukaitis for health. Now, the proposal of the European Commission combining the next multi-annual financial framework and the recovery package, the recovery fund, we are talking about 9.4 billion euro in the health sector. this is 20 times more. For sure, hopefully in July, the member states will find an agreement and fine-tuning on the proposed recovery fund and on the multi-annual financial framework. But we see that this pandemic is boosting the focus from, or combining actually the focus from recovery, economy, health, grow jobs together with health. And your question, what we would like to see as engagement of the European Union in this field in the next years, if we manage to implement efficiently this 9.x or around 9 billion euro in this sector by spreading this to research, to innovation, to prevention, to exchange of best practices, to supporting the efforts of the member states, the national governments in improving the health infrastructure and the up to the 21st century access to the last possible treatment, the last development in the treatment area, especially for important social disease, infection disease, diabetes, cancer, very important. Cancer is high on the agenda of the European Parliament. This will be a big success for the European Union and will be in line with the expectation. Everything what we hear from the Eurobarometer, from national member states opinion polls is that European citizens are expecting from the European Union engagement in the health sector. Contrary to the, for me, it was a stupid discussion about competences and about who is responsible for what. We all are responsible for the health of the citizens, and as citizens we are, if we like or not, also patients. So we should find the best combination, how the added value of the European instruments like funds and our recovery package can be of benefits for all of us and not be spent to something which will not give too big impact. And everything is related. Also our trade policy in the international trade, China, India, how we deal with this, how to do the so-called strategic autonomy of European Union for important medical equipment, medical medicines, also the field of how to, and it should be done immediately actually, to strengthen the European Center for Disease Prevention and the European Medical Agency with more staff, with more funding, but also to support the European-based research in the field of vaccine, now actually with COVID-19, and effective treatment of the COVID-19 infection. I'm very happy that in this mandate we have so many new from the old Katarina, but also new colleagues, Tomislav Sokol from Croatia, Sara Serdes from Portugal, from the S&D, Timo from the S&D from Germany, and Petra de Sutter from the Greens in Belgium here, who are very, very engaged, and together I am sure in the next years in the European Parliament we can successfully continue to give platform to you, to the stakeholders, to the Commission, for finding the best ways to serve this expectation of the citizens and effectively do the added value of to spread the added value of Europe and the European institutions to the member states. thank you very much. A lot of success, and I'm on your disposal together also, I'm sure, with my colleagues. Thank you.
Thank you so much. Fantastic. Now, is Katerina Konecha?
Yes, I'm
online?
here. Yeah.
Fantastic. The floor is yours.
I have the same trouble with the video, but okay, I hope that you can hear me. Sorry. Yeah, is it great? It's nice to see you, and I hope that you see me. Dear colleagues, participants, stakeholders, let me also welcome you to the relaunch of the MEP Interest Group on equitable access to healthcare. For me, it's the second term in the position of co-chair on this group, which during the last term, in my opinion, has proved its usefulness and importance. Thank you for this opportunity, and be sure that the door of my office is always open for you. And thank you for great cooperation with the PACT, because I think that we can see that it is the best what we have. We live in a strange time. In the light of the COVID-19 pandemic, we have succeeded in the things that we have been striving for the last 2 years, like return of the independent health fund or bigger budget dedicated to the public health issue. However, some issues like still open HTA regulation are not near to their end. European citizens are more than ever in favor of greater integration in the field of health, and we must benefit from this and use the momentum. We have now a lot of very interesting files currently opened in the European on which we will need your help and which should send a strong signal to the Commission and Member States about the future, like the medicine shortages in a report or the report on the new EU Health Fund. We must not forget also on the brand new Special Committee on Cancer. As you can see, there are plenty of opportunities where your voice can be heard, and I would like to hear your opinion of them. Thank you, and enjoy that you enjoyed this meeting, and thank you once more for your cooperation, and I'm looking for this, because hard work is between us, but in the other side, I think that we can doing good work for European citizens and for patients.
Thank you very much, Katerina. Tomislav Sokol, the floor is yours.
Hello, everyone. Thank you very much for organizing this event and for restarting this interest group, which I think is a very good initiative, because it strikes at the core of the problems and the issues that we have related to EU health policy. And I would also like to thank Andre and Katerina for continuing their work on equal access. As what I wanted to say, I mean, the problem with EU health policy traditionally is that it didn't help. Because because of the whole competence issue, the lack of resources in the EU budget, that was always traditionally a problem. But not just that. I think one of the big problems was that Andre touched upon it somewhat in his opening statement, is that healthcare was usually perceived as an expense. So healthcare was, and especially during the last economic crisis, as with the European semester, etc., focus was always on fiscal responsibility, on austerity, on reducing public expenditure, and healthcare was definitely impacted in a negative way, because this definitely reflected on the health outcomes, because as you know, the data shows that the differences in resources that member states can allocate for healthcare are directly related to the health outcomes, the lifespan, mortality of different diseases, etc., etc. So this whole paradigm was definitely negative at the beginning of the last term of the European Parliament. Now now there has been a paradigm shift. It was started with the initiative on developing the European Cancer Plan, which has now resulted in the creation of a special committee on cancer in the Parliament, which is definitely a very good a very good result of all this. So this whole debate on cancer was definitely something very positive. And of course, definitely now with the COVID-19 crisis, healthcare has come into focus of the European institutions, which is in general a positive thing, because there is definitely much more media attention, much more media coverage of the health issues. But on the other hand, there is also potential danger that all of the talk on healthcare and resource allocation, etc., will focus on the specific issue of the pandemic, fighting the pandemic, on coordination, finding the vaccine, etc. Of course, these are really important issues, but I think we have core problems in Europe concerning access to healthcare, the problem of lack of equitable access to healthcare, and this is something that should definitely not be put aside because of the focus on COVID-19. So this is, I think, one of the big things that we as MEPs will have to work on, to raise this public awareness about the core deep issues of healthcare and the problems of healthcare in the different parts of the European Union. About possibilities that we have, definitely competencies are, limited. We know that we cannot harmonize national laws and regulations. The financial responsibility of organization is at the member state, primarily on the member state level. But on the other hand, we have a lot of instruments that already exist, that we already have in the EU, that we are not using to their full potential. On one hand, we have the regulatory instruments, and on the other hand, we have financial instruments. So if we mention regulatory instruments, we know that HTA regulation is stuck at the council level for quite a while now, which I think is a bad thing. It is something that we definitely are working on to try to speed it up as MEPs as much as we can. Of course, there is also the question of cross-border healthcare directive, which was made as a result of the case law of the European Court of Justice of free movement of services in the European Union, the Cole, Decker, Watts, etc. But this directive has actually narrowed down and limited possibilities for patients to access healthcare abroad when compared to the case law which implemented the treaty directive. So this directive is limited in terms of patient access. And of course, this is a problem also for patients who can, directly relates to access to healthcare, because of course patients who cannot access adequate healthcare because of lack of resources, etc., in their own country, have a lot of obstacles that they have to overcome if they want to go abroad to get help. And the main obstacles are the privatization procedure, the having to pay upfront for the treatment and ask for reimbursement afterwards, the question of who covers which part of the expenses, etc. So the directive is not implemented in a good way, as we know. And directive in itself is pretty limiting patients' access to healthcare in other member states. This is also definitely a big problem, and these are the reasons why not a lot of patients, only 200,000 patients annually, use this possibility to access healthcare. So I think the discussion on the cross-border healthcare directive, on its implementation, but also on its content, not just the question of implementation, but also how to improve its content, is definitely something we should definitely also work on the level of the plan. When we speak of financial resources, yes, we all thought, all who are connected with healthcare in the environment, for the new standalone health program. So the last health program, as Andrei mentioned, was only 150 million euros, and it was a sub-part of the European Social Fund. So it was kind of very definitely not seen as a priority of the EU. Now we have, hopefully, the standalone health program, which is 20 times larger than the last one. But there is also one additional instrument, apart from the health program, that is not often overlooked, and that is the cohesion policy. Because if you look at the cohesion policy, whose main objective is to reduce inequalities in terms of economic development in different parts of the EU, and this obviously also can be connected to healthcare and access to healthcare. I made some calculations that around 10 billion euros were allocated through cohesion policy in the last MFF for health, mostly for health infrastructure, but also partly for health professionals, for education, and things like that. So cohesion policy is still, and I hope and I believe will remain the main source of financing for healthcare systems by the EU. And why I'm mentioning this, because you know that we are in the process of negotiating the new MFF. The COVID-19 pandemic has shifted the priorities a bit, and which of course is now the chance to get more for healthcare. But we should definitely all of these new priorities that are the focus of the current discussion should not be at the expense of the cohesion policy, because cohesion policy, I think, will remain the most strongest tool for reducing inequalities in terms of access to healthcare. One additional financial instrument that we have is the Horizon. So, the framework program on science and research, and the current atmosphere, and this was also supported by the Parliament, is to increase the funding for the next 7 years for the Horizon program. And not just that, but also to put healthcare, especially battle against cancer, as one of the priorities in the new Horizon. And I think this is also something very, very interesting, but something very important. But one problem with the Horizon, which is not often mentioned, is the fact that if you look at, since unlike cohesion policy, for Horizon, everybody is member states are in competition. Then you have the problem that most of the funds from Horizon programs for science and research go to the same member states. So these are the things that we'll definitely have to work on. Also, there are some other initiatives that I'm working on, like joint procurement, etc. But I think we can also mention this in the future discussions. So to sum up this part, there's a lot of work ahead of us, and we are already doing a lot, and I think we'll continue with this.
Absolutely. Thank you very much. Now it's my pleasure to invite a representative from the German Presidency to give us a little insight onto the planned access-related activities that the Presidency is undertaking. And I have the pleasure to welcome Mr. Ortwin Schulte, who is head of Division for Health Policy, Public Health, Healthcare Systems and Healthcare Provision from the Permanent Representation of Germany to the European Union.
Thank you
Mr.
very much. Can you hear me? Am I audible?
Yes, very well.
Just dialing in here from the Council building because we just now finalized Council Working Party Pharma, and I'm delighted to speak at this important event. MEPs, ladies and gentlemen, an overview about the access to pharma-related activities of the German Presidency. First thing I would like to do is looking back to the last German Presidency. At that time, I was head of the Presidency Task Force in Berlin, and 2007 Presidency also was quite driven by the access topic. If I think on current topics like the TRIPS waiver in the global health context, WTO, or also the initiative taken by the German Presidency on price differentiation for price differentiation for HIV. I just want to go through the access-related topics in a follow-up grouped by urgency, and starting, of course, with the proposal on vaccines and GMO temporary exemptions, which the Commission has submitted and which has been discussed in the Council Working Party earlier today, and hopefully on 1st of July will be finalized. And just to mention that we very much appreciate the readiness of the EP to finalize this important thing, which is also important for access to vaccines, very early in July. A second topic, which in parallel is also concerning the vaccines against COVID-19 topic, is the advance purchase agreements, which are currently negotiated in the framework of the emergency support instrument, and also building upon some contractual work by the Inclusive Vaccines Alliance. Then MEP Sokol already referred to the new EU for Health proposal, which also negotiations will start under German presidency as early as on 1st of July. And we indeed need, under a very, very impressive time pressure, we need solutions and coordinating ideas of Commission, Council, and EP on how to devote and distribute those new financial means. And you know, Commission proposal is 23-fold higher than the previous 7 years period, and we have a considerable amount of new instruments, and therefore I think we need quite an unprecedented speed also with the EP, and we know MEP Busoy acts as a rapporteur, and we are looking forward to a very close cooperation in that regard. Timeline is quite clear. We have to be ready when the MFS is ready, so it's quite challenging because, of course, the proposal for an alone-standing health program is fairly recent. It's caused by the COVID-19 crisis, and therefore we really need to speed up negotiations. Reference also has been made by MEP Sokol to EU HTA, and German presidency is aware of the fact that we need some progress building upon mainly negotiations under Finnish and Croatian presidency. Due to the urgency of EU for health and vaccines, we are unlikely to start before the summer break, but it's foreseen in the further follow-up of the presidency. Perhaps also in the context of access to pharmaceutical topic, it's important to mention that Germany plans an institutionalized lessons learned exercise on COVID-19 in the Council, instrument for that being Council conclusions, which should encompass all aspects we could witness during a COVID-19 crisis, and which of course includes topics like shortages, reshoring of production, implications of global health cooperation for the EU health cooperation, and also the strengthening and the increased budgetary resources for the ECDC. In that regard, we also are very happy to hear that Commission is contemplating to put forward legislative proposals on that. The global health-related part of the Council conclusion exercise is also related to the overall presidency follow-up initiative started by Finland and ending with France on global health strengthening, and there's also a connection line, of course, to EU for Health proposal, because if you read through the EU for Health proposal, you find some possibilities also to combine budgets and financing for certain projects between multilateral and EU institutions, and that's also, of course, given the challenges global health has in the current discussion about WHO, which has some very close connection lines. COVID-19 certainly reshaped the debate and also reshaped the working instruments we have, and we are glad to have the possibility, at least in July, but it's likely to be continued in September, to again resort to physical council working parties, which is far better than having video conferences given negotiation dynamics. And also COVID-19 reshaped the agenda. There are still two aspects which are also on the priority list and which will be followed up, and the one being the pharmaceutical strategy announced by Commission for fourth quarter of 2020, and of course the cancer-related activities, where we also welcome that EP is specifically institutionalizing that thing. One final remark would be there is, the role of a presidency is a bit different, but there is also a known German position on the access to pharmaceutical thing, which would say that availability of pharmaceuticals is an EU topic. Accessibility in most aspects also is an EU topic, and affordability would be something which is mainly dependent from national health system management decisions. And we are in a close dialogue with our 26 partner states, with the trio presidency, and also with the European institutions, Commission and EP, on how to realign that. And the first political level debate on shortages as well as on the pandemic preparedness of the EU as a whole will be held 16th of July at the informal health minister council, which was planned in Bonn, the former capital and now the site of the pharmaceutical market authorization, BfArM. But due to the crisis, it had to be taken to the video format. At the moment, it's undecided for its follow-up conferences on cancer in September and on digitalization in November will also be taken to the video format. That largely depends from COVID-19 developments. And we hope that the formal Health Ministers' Council 2nd of December will be held physically. And with that, I would just finalize this overview about planned German activities. Thank you very much.
Thank you very much, Mr. Schulte. And thank you also for kind of connecting some of the dots and bringing up the themes that were raised by the MEPs earlier. Now we have heard from the members of the parliament. We have heard from the presidency, and before we move to the commission, I would like to invite Eva Velo from the Patient Access Partnership to note some technical issues. Because as you have seen during this program, we have specific Q&A sessions, but there are several ways to pose questions. Eva.
Hello? Hello?
Yes, we can hear you, Eva. Please go ahead.
To tell everyone, just when you're not speaking, please keep your microphone on mute. We are going to post some questions, which you will be able to see under the chat section on the right side of your screen. Those are open questions, and we would love to receive your feedback, which is going to be visible to all of the participants. And after that, of course, we're going to share the results on the post questions.
And throughout the entire meeting, you can post in the chat your questions, because this would be very helpful during the debate for the moderators to have kind of different questions coming from the audience. and also, of course, when you want to put a question during the debate, you have to state it in the chat that you want to raise a question, so the moderator can give you the floor.
Yes, thank you very much, Eva and Stanimir. So next I have the pleasure to invite Mr. Wolfgang Brühel from DG Sante, who is there and acting head of unit. He will give us some insight on the investing in sustainable health systems and present some of the latest health-related recommendations in the framework of the European semester, which is a very important instrument. Mr. Brühel, the floor is yours.
Yes, hello. Thank you, Susanna, and thank you also for the invitation. Thank you also for this opportunity that we can speak and present our work on the European semester, especially on access here. For me, apparently, many of you already know each other, and for me it's the first time that I was also told by my colleagues that there has been an intense and a good cooperation already in the previous term between the Commission and PACT and the related organizations, and so I'd like also to extend the Commission's gratefulness and also commitment to work on these issues. I would like to present to you, as I said, some elements of the European semester. Do we have the, first of all, can you hear me? And secondly, do we have the presentation on already?
We hear you very well, and the presentation is coming. If you don't mind just starting, so that will be great. It's coming up.
Good. Okay. There has been, so I would just possibly start a little bit. There has been some, a lot, or let me put it this way, we are receiving a real lot of letters from citizens these days about how their healthcare systems are working in their member states, their experience, and also many requests on what the Commission is doing, what the EU's role is, why the EU isn't doing much more than it is doing. We're also receiving similar requests also from certain stakeholder organizations. This is not to say that we have that this is for the first time we receive such requests, but they have become more numerous and more pronounced. And so it's no wonder that this COVID-19 crisis has really put health policies in the EU in the limelight. And this also has had consequences in the European semester. I remember, I think I can say this for the internal cuisine, from internal cuisine. I remember in the early days of COVID, in February or so, a meeting between services of I mentioned that there is a health crisis coming, and this may have repercussions on the European semester. And remember that many other directors general around the floor were not yet really buying that issue. And he said, yeah, it's a health issue, Yeah, apparently COVID-19 has not remained a health issue, not a health policy issue. It has become a socio-economic issue. And this is why also the European semester, which is a process of coordination of economic, fiscal in particular, but also economic, macroeconomic, and social policies. This is why this has had a great impact on the semester. So now is the presentation on now? Sorry, while I keep.
I'm afraid not, but people are working in the background to do that. I'm very sorry for that.
A way around would be, you have your presentation there. If you put it on the screen and you share your screen, it should be okay. But let us give a last try.
Okay, now I see that something's coming. Okay.
Yes,
Okay.
something is trying to happen.
Thank you. No worries, no worries. So yes, here we go. Thank you very much. So we go to we could just go to the second slide, please. Okay. Here, possibly I would explain very quickly. I mean, you certainly know what the European semester is. This process of economic and social policy coordination, which bears the name semester, but it is basically an annual cycle. It just has the name semester because, say, the core publications, which is the annual sustainable growth strategy, that you see here, that usually comes in the late autumn, early winter, so November or this time December, and the publication of country-specific recommendations in May. This is usually half a year, but the entire for the Commission, but the work in the Commission, the work with the Council, the Member State is basically going on throughout the entire year. In the annual sustainable growth strategy, which was published by the new Commission in early December, a little but possibly 2 weeks later than usual because of the delay of the entry into office of the Commission. The Commission suggested that the economic and the social policies should be coordinated around 3 main pillars, which is productivity, productivity, stability, fairness, and environment. At the time, the von der Leyen Commission started with the commitment to make the Sustainable Development Goals one core reference point for the European semester, including, for instance, Sustainable Development Goal 3 on healthy lives, healthy living and well-being, but also, of course, in the entire environmental dimension. At the time, and this is why I have highlighted this in yellow below, however, the Commission made already quite in the text, if you read again the text of the Annual Sustainable Growth Strategy of last year, you will see that there was a clear commitment to the need to invest in health. So, healthcare or health, not seen or not just seen as an expense, but also as an investment. Similarly like education. This has always been, by the way, also a concern of us as DG Santé inside the Commission to make this point clear. And so, in a way, this thinking then prepared the ground for a rather rapid or an accelerated work to take into account the new dimension and the new situation that COVID-19 has created during the spring. So next slide, please. Thank you. Exactly, that was the little virus that changed everything. Next slide, please. And the Commission started, as you know, with the coronavirus response team of commissioners with various initiatives. I would just invite you to have a look at the dedicated website from time to time. Next slide, please. Yes, thank you. So, COVID-19 has put the health system under unprecedented stress, and so these member states responded on the one hand, they say with short-term measures such as increasing the supply of critical medical products. It could be equipment, medicines, what have you. And of course, laboratory capacity needed to be enlarged, hospital intensive care units needed to be stepped up. And especially in a few member states, we have also seen difficulty in recruiting or mobilizing healthcare workers. And relevant for the European semester, we see that the EU economy that has been on a slow and steady upward trend in recent years, especially since the financial crisis, is contracting again. It will be contracting by about 7.5% until the end of the year. We expect a rebound in 2021, but of course, a lot of this will depend on the situation, on the health and public health situation in the member states, if it will be possible. So that means that that Europe is actually entering not just an unprecedented health crisis, or is in an unprecedented health crisis, it's also in an unprecedented economic crisis. Next slide, please. So therefore it was no wonder that that in a process of economic coordination, one of the first objectives for this year was to mitigate the immediate health impacts, and also to look to of course buffer the socio-economic impacts. And this is the second big aim to get to the economy back on track towards a green and digital economy. Next slide, please. So this year, the recommendations have three main areas, which are investments in public health and health systems, in particular resilient health systems, preserving employment, you know that many people got laid off or are on short-term work schemes, and supporting the corporate sector, especially SMEs. And we would quite like to use the semester for a coordinated response for a relaunch of the economy to mitigate the damage that is done to our societies, and to also to reduce the divergences and imbalances between the member states and inside. And of course, the recovery plan for Europe that was launched by the President in May, just after the publication of the CSRs, is the main instrument for this. Possibly important to say that those four dimensions of sustainability, stability, fairness, and environmental sustainability and competitiveness would, of course, they remain. So we have just shifted in a way the focus now on the current situation. What you may also have noted that the fiscal CSRs this year are basically, they are there in a way that they are but qualitative. So the budgetary requirements that used to be there are, I mean, sometimes you see some language on this still in the recitals to the country-specific recommendations, but effectively the general escape clause of the Stability and Growth Pact has been activated, and it gives therefore the member states the opportunity to mobilize the funding that is necessary to tackle the crisis. And so therefore, and we will see, of course, we expect that if and as the economy steps up, then member states will also try to put attention to expenses in all areas, but certainly healthcare will remain an important issue there, because and this is the next slide, please. Can we have the next slide, please? Yeah, because we find that this pandemic is not a one or it's not something. It's something that has emerged, and it's not something that has that came and changed health systems which were all across the board working extremely well. No, I think we think that this crisis has exposed some pre-existing structural issues. In one member state more than in the other, but there is an issue about access, effective and resilience of the system. And therefore, this has to be improved in the long and in the medium term, in long and in the short term, and especially also the effectiveness and the accessibility of healthcare. Next slide, please. The main challenges we have identified for the health system in this year are the following. There's insufficient, COVID-19 has shown in quite a number of member states they are insufficiently funded. So yes, healthcare is an expense, but it's also an investment, and it needs to. And this is an expense that needs to be done. Secondly, but we also see that there's some healthcare systems come under strain because the revenues break down with people not paying contributions through the employment schemes. So yes, there's an issue for the financing of the health systems. We also see that on an organizational level, healthcare systems are possibly not coordinated and integrated enough. And in particular, there's a potential to use e-health and telemedicine, and also in some instances, primary and outpatient care has always been weak and continues to be weak. We also see that there's a limited capacity to respond to shocks. I mean, this is, of course, the burning issue for COVID-19 crisis. There are obstacles to the access to care, and unmet. There are in a couple of member states, the unmet needs are still rather high, especially for the most vulnerable, and which is a big issue in some member states, out-of-pocket spending. And then, of course, COVID-19 has put the limelight, or put into the limelight the fact that in many member states there's a shortages of healthcare workers, or expected shortages of healthcare workers in the next couple of years. And we also need to make sure that our healthcare workers have the right skills to cope with the challenges in the healthcare system. Next slide, please. So this was the first time in this European semester. I mean, there have been healthcare recommendations in the European semester since 2011, mainly with an increasing number over the years. Last year, 16 member states had healthcare CSRs. This year, there are all of them, plus the UK, of course, because the UK this year still, because of the transition period, is still kind of is still part of the exercise, even if not, as you know, being a member, not voting, etc. But yeah, so there's also a recommendation for the UK. And then what received a lot of attention is the supply of critical medical products in almost all member states, I have to say. The next slide, please. Also, in a very many member states, there are references to the health workforce challenges, be it shortages, be it the needs of healthcare professionals more in a way of, say, improve their working conditions, improve their training, adapt their training to the needs of the patients, and of the healthcare system. And in some member states, we have also we'll put an emphasis on the geographical distribution of healthcare professionals, because in some member states we see that some regions are more and more at a disadvantage than others. This being said, I mean, we have, and yes, go ahead. Sorry, go ahead. Next one. I have already mentioned the financial capacity. Yeah. Then I'll move quickly. Then, of course, investment, deployment of e-health. These are the CSRs. We just go through. We just continue. I mean, this is the concrete text for each and every member state, but I won't read this out now for every member state. Next slide, please. Yeah. And then the next one. Okay, and then as we become to a close to the end with the next one, please. Yeah, this is just what I wanted to show to you. This is the chart I have actually borrowed from DG Employment from colleagues. So this is what rated CSRs. We work a lot with DG Employment in the so-called social and employment family of DGs, and they have done this chart. This chart basically says that out of the social and employment CSRs, health and long-term care have the biggest part. And you see the blue lines are for this year and the gray ones for last year. You see that, for instance, back on at the bottom, pensions and active aging. This has not had a focus in the CSRs this year. No? So next slide, please. Yeah, I've mentioned the recovery plan for Europe. I'll go very quickly through this. Next slide, please. It was launched on, I think, 28th of May. You know, there's the multi-annual financial framework with 1.1 billion. And what is new, the temporary reinforcement by next generation EU. Then, of course, and then in addition, you have all those additional instruments with loans that have been set up by EIB and commissions such as SURE and EIB Guarantee Fund and the European Stability Mechanism and the crisis support. But I won't go into this. Next slide. Next slide, please. Yeah. In Next Generation EU, what is important to know about this to note is on the right, the new health program, and on the left, the recovery and resilience facility. The recovery and resilience facility will support member states' reforms, and of course, it can also support reforms in the area of healthcare, and of course, and public health, by the way, yeah, and also on access to healthcare, and of course, and then in the new health program, and these are my last two slides. If you go ahead, please. Next slide, please. Thank you. So we've already talked about the program 9.4 billion. With three main strands, which is about cross-border health stress and crisis management, medicines, access to medicines, availability and affordability of medicines, and strengthening health systems resilience and capacity, and improving access to healthcare. The last slide, please. Next one is that beyond crisis preparedness and response, now the EU for Health program will also have to focus on inequalities in health status, on preventive and curative health, and on access to healthcare, and also about and we will also work on particularly also with health for healthcare workers on health and on digital health, etc. So next, and of course, this is good to know. These financial instruments, they can be seen also in relation to the European semester recommendations. In particular, the recovery and resilience facility there is clearly, it will be this support from this will, according to the proposal of the Commission, be clearly linked to the CSR. And also for the MFF itself, we have already made this clear in the past that we want to see funding opportunity aligned, or at least, directed in a way, to also the economic and social priorities as outlined in the country-specific recommendations. And now with 28 recommendations on the resilience of healthcare systems, I think we have a very good opportunity and very good basis to do a meaningful work in the member states and with the member states. Thank you. And if you have more questions on access to healthcare in particular, my colleague Kasia is also.
Thank you very much, Mr. Burchell. Since there are no questions coming up through the chat.
There is one question, actually.
Yes, but I have a suggestion, Stanimir. I have a suggestion because we are running a little bit behind time, and Mr. Burchell is also going to join the stakeholder debate panel. So I suggest that we take this question there. From the PACT side, it's good to see that there is an instrument at the European level, the semester, that can react rather quickly in changing circumstances. And it's also great to see the new ambition of the health program. And we are keen to know how and work with you on how the access dimension can be supported through these instruments and through the program. Thank you very much, and I have the pleasure now to hand over to the moderator of the panel, Mrs. Nicola Bedlington. Nicola.
Thank you, Susanna. Can you hear me?
Very well.
Super. And I'd like to thank the panelists for joining us this afternoon, and I look forward to introducing them very shortly. First of all, I'd like to say a couple of words on behalf of the European Patient Forum Board and President to really thank the co-chairs of the interest group for their commitment towards equitable access, which, as we've heard already today, is more than ever important. The board would like to underline EPF's full support during the course of this mandate as a co-founder of the Patient Access Partnership. Really safeguarding access to care during COVID was a real challenge and concern for patients. And as we all know, patients with chronic conditions were and continue to be among the most vulnerable. This is due to a higher risk of serious illness and death from COVID-19, but also because patients are directly exposed to disruptions in healthcare provision. And EPF has been in very close contact with all of our members to really enhance understanding and to gather and highlight their really genuine concerns and insights. Treatment delay and discontinuation of care are and continue to be very real worries for particular groups of patients out there. There are changes in swift diagnosis opportunities, treatment protocols under the pandemic, social distancing creates particular challenges, behavioural change in seeking medical advice is another issue, and of course, as we've heard already, the overall economic impact. All of this has serious consequences, and I think this is demonstrated very clearly by the UCL study in the UK that's predicting 20% more deaths in patients newly diagnosed with cancer in the UK during the pandemic period. This is very sobering data. So EPF's priority is timely access to quality care, continued timely access. And of course, we welcome the proposal linked to a new, ambitious, enlarged health programme. And in a statement published in May, we outlined what our vision was from a patient's perspective. Briefly, a coordinated Europe to protect our health, making the best use of instruments that already exist, more investment in health coordinated by a strong health programme with appropriate synergies with other health initiatives, cohesion policy, research and digital, and a European health landscape where civil society, including patient organisations, play a vital role. We have, I think, a unique chance to get this right. And how can we and shall we move forward together? And this is really what this panel is all about. The title of the panel is How Will COVID-19 Impact the Role of the European Union in European Health Policy? And of course, we've heard a lot from our eminent speakers already today, and I would like the panelists to share a very, very brief impulse statement. And first of all, I'd like to give the opportunity to the two co-chairs that are still present, Andrei Kovachev and Tomislav Sokol, to actually add anything to your very powerful statements of earlier in today's meeting. Andrei, would you have anything very briefly to add following the interventions from the Council and indeed the Commission?
Nicola, it seems that Andrei Kovachev is not on the call currently.
Oh, I see. So let me then invite Tomislav Sokol, if you have any additional insights or comments following the interventions from the President.
Thank you very much. I listened to the interventions very, very closely. So I just have some remarks on the intervention by the Commission. because actually the topic of the European semester and country-specific recommendations has been very often mentioned by me, in different circumstances. So because at the very beginning it was all focused on austerity. So austerity, reducing public expenditure, public debt, deficit, etc. And unfortunately, a lot of reduction in healthcare funding in the member states has taken place because of this. Thankfully, after 2014, 2015, this paradigm shift has started to emerge. So a lot more focus has been put on the actual health outcomes, like the reduction of inequalities, of mortality, better use of funds in terms of getting more efficient results of healthcare spending. So I think this change of focus is a good thing, and I'm glad that DG Sante has managed to also kind of prove within this its own very important role within this process. Two things that have been mentioned, which are specifically problematic in Central and Eastern European countries. First is the problem of unmet healthcare needs because out-of-pocket payments. And unfortunately, we know that the economic crisis and again the austerity that was put in place at that time has in many member states, like in Romania, for instance, led to increase of out-of-pocket payments by the patients and increase of private provision of healthcare. I mean, I'm not in general, in principle, against private provision of healthcare, but if this leads to increase of out-of-pocket spending, this definitely is a problem for those patients who are less well off to pay for the treatment costs by themselves. So definitely the role of EU in this sense has been, let's say, ambivalent. And the other big problem, and this, of course, this is the result of movement of persons, is the outflow of health professionals from the new member states. And this has happened in practically all new member states, especially in the period right after the accession. This has created a lot of problems in terms of different geographical allocation of health workforce, because you know that doctors, medical professionals have especially left those areas, least developed regions, regions which are not well connected, which are usually not very well connected in terms of infrastructure, etc. And this has created a lot of problems within on the level of the EU, but also within member states in the least developed regions of some member states. So these are definitely two issues that need to be addressed. I'm glad the Commission is not.
And I think I'm very glad that you've raised those, the issue of catastrophic expenditure for patients and also this issue of brain drain. And I think these will be topics that will be front and centre for the Patient Access Partnership moving forward. I think that Andrei Kovachev is back now. Any further very, very brief comments following what you've heard from the Commission and the upcoming EU presidency from Germany, Andrei? Or can we move to the other panelists? If you're speaking, you're muted. Hello? Okay, I think because of our time constraints, let's move on to Valentina Polilas, who is from the Network of European Regional and Local Health Authorities. Valentina, the floor is yours.
Thanks, Nicola. Thanks for the invitation today. We are actually a Brussels-based association for those who are not aware of EURIGA. We represent the interests of 17 regions across Europe, counting 10 member states. To answer to your question, I think that besides being, of course, such a huge crisis, COVID-19 can be also a tremendous opportunity to really go further also with the European integration. I believe that we can actually advocate for a strong coordination at European level in the health sector. And this is really the moment to do this, because we show that it's needed, especially when it comes to face health emergency. And we know this is just the first probably other pandemics that will come. So we really need to reinforce the preparedness of our health system, and we need to do this under the coordination as well of the European Union. So I mean, being a European myself, I strongly believe in this process of the European integration. We know how it works. You know, sometimes you need a crisis also to rethink competencies. And speaking about competencies, we all know that the regional level is extremely important in this debate. And this was very clearly showed by the crisis, by the COVID-19 crisis, because indeed regions were at the forefront to face with this crisis in terms of delivery of care and preparedness of the health system. Again, I won't repeat what has been said so far, because we believe that actually there are a lot of answers already that we can find in the MFF and in the Next Generation EU. Among these answers, again, this was also quoted by Mr. Sokol, cohesion policy is indeed one of the most important ones. Cohesion policy is proving also in this programming period to be one of the main tools to deliver investment direct for citizens in infrastructure, tangible, intangible skills in the health sector. Around 9 billion euro were already invested under this programming period. And it's very important to see that the Commission is using, again, cohesion policy in the future to further invest in health system resilience. Now there is, for instance, a dedicated objective under the cohesion policy for the next programming period for indeed the health system, resilience of health systems. So this is again an important change. And again, the point that I want to make, it's around the role of regions in delivering innovation in healthcare. If I think about my members, for instance, a lot is happening in value-based healthcare, integration of care, not only vertical, but especially horizontal among social services and healthcare services, e-health. We are collecting so many data. We have so many data, and all this innovation really need to find a way to be upscale at European level. And last point that I want to make, and again, I also thank Mr. Sokol for quoting this. It's indeed the cross-border directive, because those that are actually using a lot this directive as a legislative framework are border regions. Again, there it's needed to have a legislative framework to enhance the healthcare cooperation across border. And when we talk about border regions, we are talking around 150 million inhabitants across Europe. So it's a huge amount of people, and they can actually be a pilot to understand how to further implement this directive and use it for the rest of the European population. So I hope that in the next future, the multi-level governance will be indeed reinforced, because we don't have to reinvent the wheel, but we really need to understand how to exploit all this innovation that is happening at territorial and regional level, and upscale all this through all these financial instruments and programs that were already presented by the other speakers, and how to use them to upscale all this at European level.
Thank you very much, Valentina, for your very clear messages. The importance of innovation, all of the data that your network is collecting is, of course, enormously valuable. And again, you've made the point about using effectively the cross-border healthcare directive as an instrument that is already in existence. It is by far not perfect, we've heard that, but it is there, and we need to think about how we can use it more effectively. Perhaps the other piece here in cohesion funds is actually consulting on an ongoing basis patients and citizens on what they actually want and need out of the cohesion funds in terms of enhanced access. Thank you very much for that, Valentina. I'd like to now go back to Wolfgang. We had a very specific question on the chat for you, actually. What role will CSRs play in steering funding from the recovery package towards addressing gaps and weaknesses in health systems? And how will the dialogue with the member states change when the European semester now have teeth, if you like? Over to you, Wolfgang.
Yes, can you hear me?
Yes, very clearly.
Definitely the CSRs on health and their content does have an influence in the decisions about allocation of funding. This has always been what the Commission has wanted. I mean, you may remember last European semester, we had as an annex to the country reports, we had an annex with basically the Commission's priorities for spending under the cohesion funds, so the new cohesion funds for the next programming period. So we also already at that time that the previous semester, which had an explicit investment focus, there we have identified needs for investment in the member state, including also in various healthcare systems, and also the needs and also the ways, the main themes for funding in the healthcare and public health area have been outlined per member state in this dedicated annex. So now, with 28 health CSRs, of course, this focus and the emphasis on this will become even stronger. And as I've said, also there are also dedicated instruments that will regard where, say, funding is can be promoted only, or as I say, to a great extent, if there is a healthcare CSR behind. So it basically strengthens the position of all the actors in the process, being the member states, being at European level, to advocate for a specific and targeted support for member states. Sorry, for the for healthcare investment, for health investment. Yeah.
Thank you, Wolfgang. Thank you for that. I'd now like to invite Sultan Masse Kozubek, who is the representative from the European Public Health Alliance, to take the floor. Sultan, would you mind putting your video on? And all of the other panelists, if it's possible for you from an internet connection point of view, would you mind putting your videos on? And I have to apologize myself. I have today very severe internet problems here in Vienna, so I'm not able to put my video on, but I would love to see all of you, if that's fine. Thank you very much. Sultan, over to you. You're very welcome. What are the thoughts of the European Public Health Alliance?
Thank you very much, Nicola, for the kind introduction, and I hope you can see my video as well.
Yes, we can. Thank you very much.
Good. So basically, when I was joining this call, I was reflecting how can public health NGO contribute to the discussion about the future of European health policy in the light of COVID-19, and also looking at the variety of stakeholders in the virtual room and this panel. I thought maybe the most helpful way is to think about what is in common. What are the core principles we all agree as regards European health policy? So I think all of us would like to improve population health in Europe. I think all of us would like to see a more prominent, stronger EU health policy. And I believe also we all are interested in reducing the health inequalities. So we would like to see the same health status in East and Western Europe, in the North and the South. So, and then for me, the second mental step is then how can IFA add value to this debate? And the answer for us is a public health. So basically, public health as a discipline can offer a connection between healthcare policy and, let's put it that way, non-health policy. So I think from IFA's point of view, we can have a better outcome and more efficient European health policy if we have more health in internal market, if we have more health in research, more health in international trade, more health in climate, more health in the cohesion and common agricultural policy, and so on. And to move there, because maybe that's quite an obvious link, I think we have to move out of our comfort zone, and then we have to address all of those other policies with all of those differences they have. And by acting so, we can find a way to do that, obviously, because that's we are health experts, we believe, not necessarily trade, agriculture, or research or other experts. And maybe a potential way to do that is to look at what is the mandate of the health commissioner. So what is on the policy agenda? There are many entry points for that. I would like just to name three, and basically the most obvious one to demonstrate what I'm trying to say. First, maybe start with the disease, the cancer plan. If you look at the cancer, it has itself as a disease linked to research, to primary prevention, and with that, all the policies are affecting that. The second obvious thing, the farm to fork strategy. It is interesting in the remit of the health commissioner, so we shouldn't wait a better opportunity than this, and this is clearly about food. It is again a bit out of the classical healthcare policy, and she is leading that. And the third potential is I would frame it as a One Health approach, and I'm thinking specifically on antimicrobial resistance, which is clearly a health challenge, a health threat, but very closely linked to agriculture and environment and also other issues. So I think if we focus on those entry points, then and we move out of the health comfort zone, then maybe we can achieve more health in Europe. Let me stop here. Thanks for the opportunity.
Thank you very much, Sultan. So really bridging different policies, bringing health into all policies, something that the Finnish presidency over 11 years ago were talking about and actually reintroduced in the context of their recent presidency, and also the movement towards all policies for a healthy Europe. Thank you very much, Sultan. I'd now like to move to Laurent Luet from UCOPE to give a perspective from industry. Laurent.
Yes, thank you, Nicola. I hope you can hear me and see me well as well.
Yes.
Okay, great. Thank you as well to PACT for the invitation. And indeed, my daily job is indeed to work for UCOPE, so the trade body for small to medium-sized companies. But I'm here as well, actually speaking on behalf of all the partners from the industry for PACT, so namely FPR, MedTech Europe, and Medicines for Europe. I think, when you ask, how will COVID-19 impact the role of the EU in the European health policy, I think this is already visible. I think that, and to echo what has been said so far, the EU efforts in fighting this pandemic have been really remarkable, and that, resources have been put together, and the industry really appreciates the sense of collaboration that has so far prevailed between all stakeholders. I think, of course, also we have learned very valuable lessons from the experience, and that I think will help bolster EU health policies in the future. I think if you also look back, the COVID-19 played a little bit the role of a magnifying glass on the existing challenges of the EU healthcare environment. Be it for research, rare or chronic patients, clinical trials, and of course, availability of treatment and care. The crisis has really placed the scientific community, but also the policymakers to perhaps reconsider the current state of play. And I think that's something we need to take into account, and maybe to move from this towards more efficient ways of enhancing and accelerating the development of innovative solutions and care for patients while safeguarding access, obviously. The recent initiatives from the Commission, be it the EU for Health program, as mentioned by MEPs Kovacev and Sokol, but also maybe the recent EU vaccine strategy, they clearly demonstrate there is a willingness from the European Commission to really move forward and take a more prominent role. So I think we can all only welcome such new impetus. This is something we've been striving for years now in the EU health environment. I think that it also highlighted the really paramount role of the EMA and the ECDC, that I think one should really give them credit for their reaction and their flexibility so far. they certainly deserve a greater support from all of us. No, I mean, of course, this pandemic turned the spotlight on the EU's action, but I think we should not forget the role played by the member states as well, and to also maybe follow up a little bit what has been said by Wolfgang. I mean, maybe in light of a potential second wave of the pandemic, from the lessons learned, I mean, the EU and national governments should collaborate more closely to plan for some actions as well. No, in a nutshell, I think that again we can clearly see that the EU is willing to take a more prominent role in shaping the European health policy, and I think that is something that we can definitely welcome. I think that if you look at the way it is done, I think we need to all be included and to always have this inclusive approach with the central pillars of access, innovation, and collaboration. I will stop here right now, and maybe we can have more time for Q&A. But thank you again for the invite. Thank you.
Thank you, Laurent, for describing from an industry perspective the impact of this sort of shake-up. I would just like to add a question actually to you specifically. Could you tell us a little bit more about cross-health industry cooperation during the pandemic and what you guys have learned from that?
Yeah, thank you, Nicola. I think that it's a very, very valid point indeed. I think the pandemic really showed that when it comes to health in general, I mean, sectors and all sectors have to really work hand in hand. I mean, with colleagues from the pharmaceutical, the innovative companies, but also the medicines for Europe, but also the medical technologies, we have been really working together to make sure that there is really some sort of a really strong coordination on these actions. I think we have been also working really closely with the Commission from nearly from day one. I think it has to be acknowledged. The Commission really take this role really close to its heart, and I think that it is clear that I mean, it is one of the central lessons here is that indeed cooperation is key between all the sectors, of course, but also between the different, I would say, parts of the industry in healthcare, and I think this I hope this will lay ground for also maybe further collaboration, and in that sense, the PACT initiative is a very is a clear and good example of how industry can align and for the greater, I would say, good.
Thanks, Laurent. I'd just like to check in the audience. You've been very quiet so far, and I know there've been some very powerful interventions. But are there any specific questions at this juncture for any of the panelists? I have a couple of further questions to probe a little bit more deeply. But is there anything from the audience? Okay, what I'd like to do is maybe jump back to something that Ortwin actually stressed in the context of the German EU presidency. He mentioned global health, and of course there's been a particular German initiative on global health. I'd like to get the reflections from the panelists on how could stronger EU health collaboration actually impact positively on global health. And I'd perhaps like to start with Sultan. Any views from your side, from the European Public Health Alliance side?
Sure, thank you. Many stakeholders even object, even within the Commission, to speak about global health because there is only one health. And maybe that approach clearly demonstrates how interconnected the global health related discussions are with European health or national health or regional health debates. So I think the connection is crystal clear. So how to enhance that? I think first is we talk about collaborations between different institutions, namely the World Health Organizations, OECD, and obviously the Commission. That's a very good first step. That's mainly from the institutions, and I'm not saying this is not happening, but it is even more important than before. Then if we look at the problem side, what are the key public health challenges in Europe or member states, healthcare systems are facing, patients are suffering from, we can easily realize that they are global health challenges as well. I mentioned earlier antimicrobial resistance, so this is an emerging threat, but we can look at the non-communicable disease epidemic. So they are affecting all regions of the world, basically. So, and going back to the initial spark of the whole event, COVID-19 is a global health challenge itself. And just to mention one particular topic, because I was keen in my intervention moving beyond health and healthcare sector, key determinants like air pollution, that's the more tangible, most tangible example, something which is floating around. So for me, collaboration is a must. And if we are interested and we hope to see an emerging European health portfolio and European health policy affecting non-health policies within Europe, that shall go hand in hand with increased European activity, action in global health at the global scene. And one of the ways to proceed with is collaboration, institutional collaborations with WHO and OECD.
Thank you very much, Sultan, and probably also civil society needs to get its act together as well on that collaboration too. Super. Valentina, would you have any thoughts from the point of view of Eureka?
Well, of course, again, I represent the regional level, but I do believe that we contribute to the overall approach of Europe to health. And again, I totally agree with Zoltan that it's important to reinforce the international cooperation among the different organizations. But what is really important, I think, is also to really stress the excellence that we have in Europe when it comes to talk around health. And this is something that we should do really at international level when it comes to talk about global health, because we are at the forefront when it comes to talk about health. We are at the forefront as for research and innovation, for manufacturing, and for our health system. And we should be proud of it. And I think that the European Commission and the European institutions should really represent all this in all the international fora, because we do represent the excellence at the international level. And this has to be, protected somehow, and should be also given to the rest of the world. And I'm pretty sure that during this crisis and with all the consequences that this will be on the long run, we can reinforce our position as a strong leader at European level in the health sector as European Union.
Thank you, Valentina. We have a slightly more specific question coming from the audience. How can we reconcile the need for better preparedness and strategic autonomy with the need to safeguard openness of the European Union? Where do you see the role of multilateral institutions such as WHO and WTO in improving access? Wolfgang, any thoughts from your side, from the Commission side? We can't hear you. Are you perhaps on mute? Thank you.
Now you should be able to hear me?
Yes, perfect.
Okay. I think we'll put it this way. Looking forward, like such a WHO or in the World, also in the World Trade Organization, when it comes to trade in possible medical goods. The EU does have a strong role, and its strong role is as strong as or as strongly as its unified. So we do have an exemplary role. We have a role of excellence, as was just and we are in. I think we are in a position to lead and also to give positive examples. And I'd like to refer to the recent unveiling of the vaccine strategy by our commissioner. And there she said, for instance, that no one is safe until everybody is safe. And we will leave no stones unturned in our efforts to protect EU and global citizens. And concretely, we are working with President Rosti's global coronavirus virus response pledging event in May. There will be a new one, a follow-up one in just 2 days. So there, the EU can play really a huge role at the same time, and this will be a part also, by the way, of the forthcoming pharmaceutical strategy. The EU does have an interest in reducing dependency on certain raw materials, and it does have and it also has therefore also an interest in reducing possibly and potential influence on its own stance by third countries. So I think it goes in both ways. We have everything that makes us united and strong and improves our excellence and our way and our it can be used at the international stage to promote a global health approach.
Thank you, Wolfgang. Thank you very much for that response. I'm now told that Sarah Seres, one of our co-chairs in the interest group, has joined the meeting, and I would really love to hear her perspective. I'm sorry you weren't able to join all of the discussion, but from where you're sitting, Sarah, how do you feel COVID-19 will impact the role of the EU in European health policy? What's your aspiration as one of the co-chairs of the interest group? The floor is yours.
Hello, everyone. Thank you very much for the invitation of being here, and I hope you all can hear us. For me, it's with great pleasure I'm here, and I'm very sorry to just arrive now because I was hold on to another meeting. But I can see that we have some really interesting discussions on how we can improve the role of health in the EU, and this is of special importance because we just had we are crossing, not just had, it's not the past, it's the present and the future. We are through one of the most important pandemics in the last 120 years. It caused many disruptions, which I won't go into details. We all know about it, how it affected most of society. But there's important lessons here to be taken. And first and foremost, I'd like just to congratulate the Commission for finally realizing the importance of health policy or European health policy. And for the first time, we have health program, the EU for Health program, which I'm a shadow rapporteur for, with its own program, and it's not with the ESF Plus. So this was a major difference, and with the proposed budget increase from 500 million euros to 9.4 billion euros. So first step, health is important, and this is what the pandemic made happen, which was to bring health to the center of the discussion, and it highlighted also the crucial role that health has in our societies and the intrinsic link between a healthy society and the stability of the whole society, as this affected not only the health sector, but many other sectors, such as transport, tourism, trading, economics, and so on. Talking about the EU for Health program in specific, I mean, we're now working more through the different shadows and of course with the rapporteur, and trying to work and improve with our positions. And the EU for Health program is an important opportunity to place health at the core of European policies. And the main goal should be to improve health and well-being across the EU and reduce the burden of disease. And with this, we will be increasing the quality adjusted life years, the QALYs. That will be really important because there's a need to reduce health inequalities, not only among member states, but also among regions. We see many disparities, and these are through avoidable causes. So this links to another part, which is really important to have in this program, which is, okay, how can we tackle the causes of disease? Health promotion is hence of the utmost importance. With health promotion, we will have better health gains and lower disease-related costs. So at the long run, and this is quite crucial, in public health, we have long-term perspectives. It's very hard to have short and medium-term games. It's usually a marathon playing game, and it's important to reduce the costs related to disease, especially diseases that are caused by avoidable causes. And this leads me to another part of prevention of disease, which is we must focus on primordial and primary prevention, which is to reduce the exposure to risk factors and also the avoidable risk factors. So for people to be able, together with health promotion, to make healthier choices. Of course, as I'm talking, this is very broad and this is very important. How can we project it and implement it at the EU level? So this is a comprehensive program that already came in the Commission proposal. We're just making some improvements at the Parliament level, but we want to have person-centered health. So to have person-oriented healthcare, not disease-oriented healthcare. So we want to move from the part from looking at the different diseases to the part at looking at the person and have a holistic perspective of the person. And this is the main difference with the current healthcare system. I'm a medical doctor by training. Most of my medical school was spent looking at the different diseases and the different systems and how they interlinked. And very few was looking at the bigger picture, the patient and the person as a part of the community and the society. And this is what public health does. So with great efforts from all the different stakeholders, hence the importance of being here in this meeting, with the help and the cooperation with the different stakeholders, I really truly believe that we can improve the European health policy.
Thank you very much, Sarah, and thank you for your commitment as a co-chair and highlighting this balance between health and stability as we move forward, underlining the importance not only of health but well-being, and that's been a major topic over the last couple of presidencies. And then this long-haul perspective, we're not in it for the short term, we need to think seriously about the longer term, and this in a sense echoes some of our aspirations around the Sustainable Development Goals, and particularly, of course, the SDG on health and this whole area of universal health coverage. Look, we're running out of time. I think we had one other question from Stan, which I hope we'll be able to squeeze in. Stan, would you like to pose that question, or do you want to integrate it in your closing comments?
Yeah, actually, I will integrate in the closing remarks.
Fine, very good. So I'd like to quickly close this panel by thanking all of the panelists very much. I won't invite the co-chairs to take the floor again because I think there'll be a couple of opportunities to actually hear from them towards the end. But Valentina, I'd just like you to give one word, share one word with us on what actually encompasses your vision, your ambition for the future of health cooperation at European level. Just one word. And I'll be asking all of the panelists to do that too.
Leadership, strong leadership at European.
Thank you. Thank you, Valentina. Sultan.
My one word will be about the key challenge which we have to address and to have a powerful EU-health policy, and this one word is commercialization.
Commercialization. Thank you very much. And then to Laurent then. One word from you.
Yeah, I was indeed on mute. I would say ambition, to end on a positive note. Ambition. Yeah.
Thank you. Thank you. And finally to Wolfgang, before we close this session, what would be your one word, Wolfgang? I think you're on mute.
Sorry again. It will be two words, basically, upward convergence.
Upward convergence. Great. Well, thank you all so much for your contributions in this panel. We've had a very short period of time, but we've managed to explore a number of really key topics. And my big message, my takeaway message, I think, is the real commitment to genuine, long-standing collaboration to move forward on health cooperation, together. The health crisis that we've been suffering over the last few months is not just a health crisis, it's a humanitarian crisis, it is an economic crisis, and only by deep-seated trust and collaboration are we going to be able to move forward together. With those words, I'd like to hand the floor back to Stan, who is the Secretary General of PACT, and to the co-chairs to close our session today. Thank you very much.
Thank you very much to everyone. I would like to thank also for the co-chairs to accepting being co-chairs of this of the new interest group on access, and those who continued from the previous years. I think it's time now, when we are recapping the example of the COVID pandemic, to look into the future and actually to see where are the opportunities ahead of us. And I think that there are huge opportunities to put access, healthcare, much higher on the political agenda, to demonstrate the importance of that, to actually make health much more understandable for the different sectors that were mentioned several times here, which are directly affected by the COVID crisis, and at the end to achieve much more united, comprehensive and coordinated way that we provide quality healthcare for all. And this is actually what we are trying to achieve according to the Sustainable Development Agenda and goal number 3, quality healthcare and services and products for all. This is what PACT is trying to achieve in the last years. And if you remember, last year, when we had the elections for the new European Parliament, PACT had a conference. And during this conference, we agreed for first time ever among all the different stakeholders about a couple of things. We agreed about what matters for us and how we will make sure that in the next 10 years we will work together to achieve quality healthcare for all in the European Union. Nowadays, only a few months after the COVID started, but now I look back into our final document that we called the Health Pact, if you remember, and hopefully my colleagues could show the Health Pact on the screens. The Health Pact is even more relevant today when we have a clear real-life proof about importance of cooperation. Here we have outlined months before the COVID what matters for us and what we need and have to work. And I think for PACT now and for the interest group on access, we have much more stronger arguments to fight for everything that we have agreed. I would say that we should be much more braver when we propose legislative proposals. We should be brave when we talk about the future of health. We should be brave when we are talking about quality of care. We should be brave when we are talking about dissemination of models of excellence. We should be brave in everything that we know and have evidences showing that it works good for patients and for the stakeholders we represent. With this in mind, I think it's very important to conclude the following. Health and well-being have always been kind of topic that's considered to be the topic for the medical community, let's say. This is again one of our medical community or medical community supporters meetings. And I would like to propose from now on this one to be probably one of the last or the few purely our community meetings, and to try follow what is in the new approach of PACT, trying to involve the others, try to involve the economists, the ecologists, and to incorporate variety of topics, labor, education, and how we together could raise our societies and healthcare systems to a new level that can lead us to economy of well-being rather than systems working in silos that are not ready to meet global threats or such as this one. With this regard, I would like to stop with my intervention and to wish success of the interest group on access. You know that PACT would continue to support the secretariat and the work of this interest group. I wish you to be very, very active as co-chairs, and also your colleagues from the European Parliament. Feel free to come back to us to propose your ideas for topics, for events, but also our partners. You know how variety of partners we have. We are quite active, and we are not going to be shy when we are proposing initiatives for you that we believe are going to be helpful for Europe. And this is going to be with me. If somebody from the co-chairs wants to say some final words, and then we close the meeting.
Maybe Sarah Cerdas would like to say something. At least she's there.
Yes, I'm here. Thank you for giving me the floor, and thank you for all the kind words, and also for a strong mandate for the interest group here at the European Parliament. I know we come from different political groups, but in one thing we are very, very much coordinated, which is in advancing and improving the accessibility of healthcare, and also to improve health and well-being across the EU. So I'm very happy to be part of this group, co-chairing it. And I also believe that many of the contributions that we received today during this event will be very important, not only to incorporate the EU for Health program that it's now being discussed, but also to guide us in our mandate for better health and well-being in the EU. So thank you very much, and with anything I can help, feel free to contact me.
Thank you, Sarah. Well,
yes, thank you. Okay, go ahead and close.
Yes, we will be back with the report very soon.
Goodbye, everybody.
Bye.
Bye.
Bye. Thank you.
Bye, thanks.
Thank you.
Bye.
Thank you very much, everybody. Thank you. Bye-bye.